Dr. Zhitnitsky, while all of us have learned how to brush teeth in school from our parents, and nevertheless, I keep seeing there are all kinds of different opinions still out there. There's still the this, there's the that, there's the like this, and also these days we have, we have electric brushes and all that stuff. Can you basically shed some light on it, what your take on the cleaning thing is?
Oh, absolutely, absolutely. Brushing and flossing your teeth is a very, very important part of your hygiene.
Sure.
It should be done hopefully after every meal if you can, and at least twice a day. And the good news is you don't have to floss all your teeth, just the ones you want to keep.
Oh, yeah. Trying to be funny.
Over the years, we had many different ways and many different techniques of brushing. Some people say side to side and up and down or little circles. But what everybody agrees on is that when you're using a toothbrush, the bristles have to be pointing into the gum at about a 45-degree angle. So for your top teeth, they should be pointing up, and for your bottom teeth, they should be pointing down. And you should be trying to get every surface of your tooth, and brushing should take about 3 minutes. And if you can get an egg timer, you'll be surprised how long it is. Usually people are done in about 30 seconds or less.
Well, I know that my wife is still brushing after we start brushing together. She's still brushing. I finished showering. I finished shaving, and so she does her 3 minutes. I think I do my 35 seconds.
Yes, the limitation of all brushing is that toothbrushes don't reach between your teeth. And this is where gum disease starts. That's where flossing comes in. Flossing is extremely important because the floss is usually the only instrument that reaches between your teeth, underneath where contact or two teeth meet. And that is where gum disease starts. So if you're brushing really, really well, but if you're not flossing, you're still at risk.
Anything we should be careful of, or any mistake you have found amongst us patients which we routinely make when flossing?
Oh, absolutely. People really floss hard, and they move their floss side to side, and in essence, you're cutting your gums like you're getting them a little paper cut every time you floss. Flossing is something that should be gently wiping away bacteria and plaque. It has nothing that you force. It has to be very, very gently because we don't want to traumatize gentle gums between your teeth. We want them to be healthy.
I see. So yeah, I think I do that. So what I call massaging the upper thing, actually I might be cutting it.
Right. If it's too rough, as I would tell you, like one parent to another, you treat it like you treated your baby's bottom, very, very gently. The trick is actually to do it for a longer period of time, but very gently, and not very, very rough and fast.
Okay. What about mouth rinses? Are they any use? Are they any good?
Absolutely. There are a lot of them. There are some of them that are prescription strength that kill bacteria. Listerine is shown to kill bacteria. A lot of just the action of swishing something around your mouth, whether it be water or a mouthwash, actually washes away some bacteria. So it's definitely a good idea to rinse. It's better to probably do it before you brush because some of it also loosens up plaque. There's special mouthwashes that loosen up plaque, so absolutely.
Interesting. Now, in 1995-96, I've lived for a couple of years in India, and there I was introduced to a thing called a tongue scraper. And I did use it there, but then as I came back, I kind of, lost it, broke, and I never got a new one. But ever since, I am brushing my palate and my tongue. I have to admit, I gug every morning a little bit when I, put it back there. Can you tell us a little bit, is a tongue scraper a good thing to use? A brush an okay substitute? Is neither one of them a desired thing? Tell me.
Well, the top of the tongue, which is called the dorsum, has a lot of little nooks and crannies that food and bacteria can get stuck in. And it's actually a very good idea to clean it. And you can definitely use a tongue scraper as long as you're using it gently, or a regular toothbrush with some toothpaste would work just fine too. But the important thing is not what you use to clean, but the fact that you clean it is very, very important. And it actually has shown people to reduce bad breath in certain patients if they clean their tongue. That's actually the first thing that I tell them to do. They're not brushing your tongue, brush your tongue.
So we should brush it off. So I'm doing a good thing.
Absolutely.
Since the year 1995, because I haven't done it before. I saw it in India. I figured if a culture which has been there for thousands of years, longer than little Austria and longer than America, I guess I couldn't go so wrong following them.
Absolutely, absolutely.
All right, Dr. Zhitnitsky, thank you very much.